Hello, I'd like to do this video on chemical dependency evaluations because they come up a lot in criminal defense work, a lot in the criminal justice system, and it might be helpful for folks to know a little bit more about them. So a chemical dependency evaluation is an evaluation that you take with a therapist or a counselor to evaluate if you do have any drug or alcohol issues, and if you do, what you might need to do to remedy that. So most of them come out on a 4-point scale, or I guess really 5 points, because you could also have a 0 as a result. And I'll just briefly describe that. So if you get an evaluation, you normally get those done at chemical treatment centers. You can get them done at your local hospital. And there are also lots of private evaluators that offer their own evaluations and just work completely independently on their own. And here at our law office, we work with all sorts of different evaluators that we've known throughout the years. And some of them are affiliated, again, with some of these large treatment facilities. And some of them, again, are just folks that act and operate completely independently, and you can meet with on that basis. So a evaluation, again, usually comes out with a score, and the score could be a 0, and a 0 usually essentially means you don't have any need for any kind of treatment at all. You don't have any need for any education or any classes or anything at all. That the thing that happened, whatever it was that you might be concerned about, was considered an isolated incident, and the evaluator just can't think of anything that would really be legitimately helpful to you. Now, in practice, these are pretty rare. It's pretty rare to get a 0. Every once in a while, you have someone who really has just absolutely no history of any kind of use whatsoever, and we'll see an evaluation that recommends absolutely nothing. More typically, though, even if it's a person that has no prior criminal history, no issues with drugs or alcohol, you'll get score as a 1 or a 2. So a 1 on a chemical dependency evaluation is just the need for some education. The idea that, well, in a way, we're all could probably benefit from education about drugs and alcohol use and maybe overuse. And it's very, very common to have an 8 or 12-hour class recommended at a level 1 from a chemical dependency evaluation. Level 2 is at risk for chemical abuse. So not dependency. The evaluator is not saying that you have any kind of addiction issue, but that when you tend to use alcohol, or when you use alcohol, you tend to abuse it, drink too much, and act out or create problems for yourself, and that this isn't just a one-time thing, that this is something that tends to happen pretty consistently for you. And so a level 2 would normally be a recommendation for some more lengthy kind of coursework or time with a therapist, kind of going over, well, why do these things happen, and what might be the best way to kind of change that behavior. Sometimes you can get a level 2 recommendation that also includes a recommendation for co-occurring therapy one-on-one with a counselor. So they'll say, well, go to a 16 to 24-hour class, or classes that would add up to around 24 hours or so, and additionally go and do some individual therapy to kind of address this issue, just a one-on-one with a therapist. Most of the coursework or classwork that you do at treatment centers for level 2 is usually group work, and so then the therapy can kind of add some more, some more individual attention to what a person might need. So that's very, very common for folks who have a second-time DWI or have maybe a small history of chemical use, something that's concerning, but not really a one-time thing. A level 3 is a determination that a person is chemically dependent. So this is a recommendation for usually 40 hours of treatment and then an additional 40 hours of aftercare. So a large amount of kind of coursework, group work, therapy would be involved, and it would be recommending an outpatient program. So with the level 3, the recommendation is not that you need to quit your job and or take leave of absence and go into a treatment center for a month, but it is recommending that you might go someplace 3 times a week for 16 weeks and then scale down to maybe once or twice a week, and then maybe just even once a month here and there, or just AA meetings. So level 3 is certainly a significant recommendation. There's a lot of work that's going to happen for the client if they want to take that recommendation seriously. And then at that point at our office, we really try to decide what might be the best outpatient program. Are there any other issues that might be going on, and try to be really specific and careful about where the client might choose to go, because it's a big commitment, and you really want to make sure that you're getting the right kind of help if you're going to be investing that kind of time and effort into addressing a significant addiction, significant chemical dependency problem. And then a level 4 recommendation is when a person is certainly found to be chemically dependent, but also really needs inpatient programming. Somebody who needs to be in a program, stay in a program for at least a month, not be out. Frankly, probably somebody who can't be in a program where they can leave, because if they leave, they have a high risk of using whatever their drug of choice might be, and that the inpatient setting, at least for a short amount of time. Sometimes an inpatient program could be as short as 10 days, although frankly I find that most of the time at least 30 days or 28 to 30 days is really a good amount of time for an inpatient program. And there are well-known programs here in the Twin Cities that go 12, 13 months. So it can be a broad range of what inpatient treatment really can mean for a client when they get that recommendation. Of course, very important what we might recommend, or where a person might want to go to do an inpatient program, and we take quite a bit of time to make sure that that's a good choice. So the evaluations themselves are pretty thorough. I think if done right, they're very thorough. They usually include at least one, but usually 2 collateral contacts, so folks that the person knows. So if a younger person comes in, there might be a contact after the evaluation with their, one of their parents, somebody who knows them well. Certainly spouses, girlfriends, boyfriends, stuff like that are people in the know about the person being evaluated are great collateral contacts. So they also include things you think it should, like some time spent in a person's background, any kind of criminal history they might have, instances where drugs or alcohol has affected their home life, their family life, their job. Are they working? Are they happy there? Is there grief going on? Might there be some large triggering events in a person's life that could be affecting their use? And so a good chemical dependency evaluation is really worth its weight in gold, not only for the criminal case, where the lawyer can get a grip on kind of where a client might be with their use, but for sure with the courts in general, the judges who might be hearing the case, and prosecutors who are looking at the case and trying to see how they might want to handle their end of it, how they might want to handle the prosecution, or any plea agreements or offers that they might want to make on the case. And so chemical dependency evaluations, again, come up a lot in criminal defense work. They're really important to get right. It's important to get to the right evaluator. It's important to be honest with the evaluator, and certainly to look at the recommendations and make an assessment as to what needs to be done after you see the recommendation, and kind of compare that to what's going on in life. So very, very helpful tool in criminal defense work, something we deal with a lot. feel free to give me a call if you have questions about evaluations and just how they might be used in the defense of a case. So thanks.